Okay.
Good morning, Cal. I'm Kathy. I'm the nurse that's on the unit today, the student nurse that will be working with you and helping you today. You've been admitted to the neurosurgical unit at Lake Ridge Health, and I'm just here to assess you. So the first thing I'm going to do is just your breathing. Cal, you know you were in a motor vehicle accident and you came in through a merge. You do have a few abrasions and bumps and bruises, and we're just going to keep assessing you here because you've been admitted to the unit. Just going to get your pulse. Cal, I'm just going to check your armband too here. Yes. Good. Okay, going to get your blood pressure. I'm just going to check your pupils. Listen to your chest. There is an area here that I feel subcutaneous emphysema. I'm just going to make a note of the area that involves. And listen to his chest. Then I would listen to his back of his chest as well. Cal, can you squeeze my fingers? For safety. There's pupil reaction, where pupils are 4 millimeters, and they did react briskly. I'm just going to check for pain response.
things going?
Well, I've been talking to Cal, but he's not responding. He did respond to pain, stimuli.
Okay.
So Cal, this is my preceptor who's just come in. I'm just going to talk about you a little bit. Remember you were in that motor vehicle accident?
Okay. All right, then I'll come back when you finished your assessment then.
Okay. I need help in here. I need help in here.
What's up, Kathy?
He's seizuring.
Okay.
I'm just going to get him on his side.
Over towards me.
Good.
Okay.
Yeah. Feel away behind. Okay. I'll get these side rails up and stay with them. So the time that it started, watch them.
Okay. Have you got the suction as well?
Yes, the
Okay.
section's here just in case. I'm just going to position his head to the side.
Okay. Has he stopped seizuring yet?
Yes, he just stopped.
Okay. I'm going to go and get them, see what he's got for medications, and I'll be right back.
Okay. Cal, I just had a little seizure there. We're just getting you something for that.
And let me just see what we've got on the doctor's orders here.
You're okay? He's breathing. He's got good airway.
And 4 milligrams of EPI for seizures.
His airway's open.
Okay. All right then, Kathy. Where's your ID? And I'll get this out of then. Right in here. Okay. And what was his last blood pressure?
His last blood pressure, just let me see, I've got it written down here, was 131 over 84.
Okay. Okay. Well, what I'm going to do is I'm going to stay here with you. If you could just let the doctor know, if you could give the doctor a call.
Okay, I will do.
Okay, Cal.
Do you want that pillow left there?
Yeah, I'll hold him there, and then we can see how he does.
Now, okay, so I'm just going to verbally call the doctor. It's Dr. Smith. Hello, Dr. Smith. This is Kathy Cummings. I'm on the neurosurgical floor at Lake Ridge Health Oshawa, and I wanted to call you about Cal McConnick. He was the 21-year-old male that was admitted last evening with cerebral contusions. Well, through the night, about 2 o'clock in the morning, and he just had a generalized seizure. It lasted approximately 2 minutes. So he experienced the NVA at 2 o'clock this morning. He was brought to emerge. His C-spines were cleared, and his initial CT scan was normal. But he also has a fractured rib and a chest tube inserted for a hemothorax. So after the seizure, his GSCS is 9. His blood pressure is 130 over 80. The monitor is in sinus tachycardia. His respiratory rate's 22. My preceptor checked his pupils. They're unequal. The left is 6 millimeters, the right is 4, but they did both react briskly. And he is withdrawing to painful stimuli. His eyes opened. What we would like, I consulted with my preceptor, could you please come in to see him? And do you think he should have another CT scan since this seizure? And depending on those results, should he be transferred to the ICU for closer monitoring, because our patient nurse load here is such that it's a little more difficult to spend a lot of time with him. Thank you, Dr. Smith. I'll just wait your orders.
Okay, Kathy. And so if you want to just check him, we'll do your reassessment, and then I'll see what we can do about getting that CAT scan done.
All right.
Okay.
Cal, we're just going to check you again. Just going to do your vital signs. I'm going to check his pupils. Just going to look in your eyes again. I'm just opening them up.